Welcome back. The World Health Day is commemorated globally on the 7th of April. This year's theme is building a fairer, healthier world for everyone. According to the World Health Organization, WHO, the COVID-19 pandemic has undercut recent health gains, pushing more people into poverty and food insecurity. It's also amplified gender, social and health inequalities. Well, Professor Firoza Motara is head of emergency medicine at Wits University and at the Charlotte Maxeke Johannesburg Academic Hospital, and joins us now for this conversation. Prof, thank you for talking to me. Building a fairer, healthier world for everyone. Easier said than done, particularly in the South African context.
Morning to Lasizwe and to your viewers. Yeah, absolutely. And I think I agree with the World Health Organization. If COVID has taught us anything, it's highlighted those inequalities, particularly in countries where there is a shortage of resources to begin with. I think for me, there have been positives and negatives that have come out of this whole pandemic that we've had to deal with. The negatives is obviously the people that we've lost, family members, loved ones. We've lost 53,000 plus South Africans to the pandemic. And that's a loss of wealth to the country. You know, it's economically active people who were breadwinners to their families. And, you know, those people are all now left destitute. It's put a huge amount of strain on our healthcare systems across the country, both public and private, in terms of what resources were available, to deal with that pandemic. Obviously, you know, some institutions were stressed to their limit, and had to deal with the overwhelming number of really critically ill patients. And that again highlighted the lack of resources, particularly of ICU beds and ventilators and critical shortages of trained nurses in those instances. However, in spite of that, we've dealt with it. We've come out, I think, stronger and wiser for it. The positives have been the overwhelming commitment from our staff, both doctors, nurses, cleaners, our porters. Every single member of our healthcare team have pulled together to make the system work, sometimes under very difficult conditions. We all know about the PPE shortages and procurement issues. And in spite of that, we've still made it work. The fact that we've built bridges and nations.
All right, Professor Motara, it seems like we were losing your line there a little bit, and I don't know if we can give it one more try and see whether it does improve or not. You were talking about the positives. You started with the negatives that we've picked up from COVID-19, and we got that part. It's only when you turned to the positives that the line started to break a little bit. I don't know if you can pick up from there.
Sorry to Lasizwe, I lost you there for a minute.
Yeah, you were saying there have been negatives that have come out from COVID-19 and the response thereto, the negatives you listed, and you are now listing the positives that you have observed, and you had started with the commitment shown by the people within the health system.
Yeah, no, absolutely. You know, I think our staff generally work under challenging circumstances a lot of the time. In terms of working hours, shortages, we have a chronic shortage of doctors and nurses in the country anyway. And, you know, having to deal with an extra load of patients who are critically ill, often added to that. And, you know, add to that the fear, the anxiety, the challenges of working with COVID patients and then having to take, you know, your potential exposure back home to your family, to your children, to your elderly parents. It's hugely challenging. But in spite of that, people have still committed to doing it.
And in terms of the issues that emanate from other challenges that are not directly health challenges but have an impact on health that have come out from COVID-19. I wonder what comments you can make, for instance, around issues to do with nutrition, with people losing their livelihoods and facing those kinds of challenges. How is that feeding, for instance, into the kind of health challenges? Because when the WHO says COVID-19 has had the impact of eroding some of the gains that had been made, I'm wondering to what extent are you as healthcare practitioners and specialists in those fields seeing the evidence thereof in areas such as nutrition, in areas such as, diseases that have to do with access to water and the likes?
So I think hugely significant. As I said, and you've just mentioned now, people, not being able to eat a proper meal, particularly our children, and one of the things that we raised fairly early on was the fact that, schools were closed. And for a lot of our kids, the only meal they do get is the feeding schemes that we have at school. And that meant that those children weren't even getting that nutritious meal once a day or twice a day at school. So, it's impacted on far more than just the health. I agree with you. The other area where we've been significantly concerned, and I think they're trying to pick up on that now, is our vaccination, normal vaccinations, not just the COVID vaccine, but our normal childhood vaccine program, where people have, children haven't been taken to the local clinics for their vaccines. Another area is where we've had particularly our elderly patients with chronic illnesses, heart disease and lung diseases, that haven't been coming to hospital or going to the clinic for their normal medication, their monthly medication, which means that we're now seeing really critically ill patients, who are presenting to our hospitals as a result of not being on their medication. So it's had impacts beyond just, actively dealing with COVID. In terms of, nutrition and medication not being accessed or taken on a regular basis, definitely that affects healthcare. You can't take medication if you haven't eaten. A lot of the tablets or medication that people are on needs to be taken with food. Yeah. But if you don't have a job and you don't have food, how do you do that?
Lastly, Professor Mutara, what can you say about what the COVID-19 situation has revealed about our healthcare system as a whole? How urgent has it made the conversation around, access to quality healthcare, regardless of where a person finds themselves in the country? Just that basic standard of care that ensures that someone who's admitted at Mpuleni Hospital in Eluguatini in Mpumalanga gets the same kind of care as someone who's admitted at Charlotte Maxeke in Johannesburg, and so on and so on.
Yeah, I think you raise a very important point, and I think we've known that there have always been challenges. What COVID has highlighted is how do we deal with those. It's fine that we know what the problems are, but what are we doing about it? We've been fortunate for Gauteng in terms of that our Department of Health principals have really been interactive and engaging with us on many levels to where we've raised concerns and we've said, look, this need, the PPE issue, for example, we raised and it was taken note of and it was dealt with. So I think the whole ethos of people on the ground knowing what needs to be done and how it needs to be done or suggesting ways to improve it is being taken note of. We have what we call a cluster system within our hospital where, for example, Charlotte is almost answerable for a number of hospitals below us so that they have access to us both on a referral pathway for the patient, but also access to senior clinicians with experience that they can phone and ask for advice. I think if we're on our way to NHI, which is a significant program that we're going to embark on, then a lot of these problems that we're having, staff shortages, medication, consumable shortages intermittently, will have to be looked at.
All right, thank you for your insights. Really appreciated that. Professor Firoza Motara there, she's head of emergency medicine at Wits University and also associated with Charlotte Maxeke Academic Hospital, having this conversation with me on World Health Day.